Good afternoon, everyone. My name is Dr. Saima Hussein, and I'm a pediatrician at Longstreet Clinic. I want to start by saying thank you for tuning in to our Facebook Live session. For those not familiar with Longstreet Clinic, we are a primary care and multi-specialty clinic. We have 10 locations throughout North Georgia and more than 200 providers. We represent 19 medical specialties, including pediatric offices in Gainesville, Beaufort, Baldwin, Brazelton, and Oakwood. Since the start of the pandemic, we have been working closely with many community partners, including Northeast Georgia Health Systems, Northeast Georgia Physicians Group, the Department of Public Health, and our school system to get important information out into the community. We are back again today in hopes we can provide helpful information to families about safety precautions related to COVID-19 for this upcoming school year and how vaccines will impact this upcoming school year. I'm here today with a wonderful panel, Dr. Megan Farley, fellow Longstreet Clinic pediatrician, Dr. Supriya Manapalli, Northeast Georgia Health Systems Medical Director for Infectious Disease, Dr. Zachary Taylor, Georgia Department of Public Health's District 2 Medical Director. And we are lucky to have local school representatives with us today as well. Andrea Williamson English from Hall County School System, representing both Hall County School System and Gainesville City Schools, and Scarlett Pendarvis from Lakeview Academy. Together, we'll answer the most common questions we're hearing about COVID-19 and kids, so you as parents can make informed decisions for your family. We will also talk to our local school representatives to answer questions about what the upcoming school year will look like and how vaccines may impact school, activity attendance, and quarantining. I'm going to direct each question to one person. However, we want this to be a conversation, so I encourage you to jump in if there's anything else to add. We will also monitor questions in the comments from our viewers, and if we have time, address a few at the end. We have a lot of ground to cover today. Thank you again to our panelists and to everyone joining us out in the community. I'd like to start with Dr. Taylor. Dr. Taylor, last time we gathered together, Pfizer's COVID-19 vaccine had just been authorized for use in those 12 and older. Can you walk us through again the timeline and quality standards for the authorization process of this vaccine for children?
So to be clear, this vaccine has undergone all of the same types of investigation and scrutiny that any vaccine goes through before it's approved. The vaccine was a little more faster or quicker than we would normally see, but there were a lot of reasons for that. One, obviously, was the urgency of the pandemic and our need to respond to this and protect our population. The second reason is that these pharmaceutical companies already had the cohorts established that they were going to vaccinate, and were able to rapidly prepare the vaccine using this new technology for the messenger RNA type of vaccine, and get that to the trial participants. So it's gone through every level that a vaccine would normally go through to get to this level. As we all know, initially it was approved for adults 18 and older. And in the case of Pfizer, it was initially approved for persons 16 and older. And they completed trials in the springtime that showed that it was also effective in children 12 to 18 years of age. So it is still under an emergency use authorization. It's being considered by the FDA for full evaluation or full approval, which we expect to happen sometime in October.
Great. Can you provide a snapshot, Dr. Taylor, on how the vaccination efforts in children 12 plus have been going since the authorization, both locally and nationally?
So it's a little slower in children. When we first rolled out the vaccine, as you probably all know, there was an incredible demand. And this was in the older population because they were the ones that were primarily affected with severe disease and illness, and with hospitalization, and unfortunately also with death. So it's been a little bit slow nationally and throughout the state. I'm about to give you the information. In our state, for those who are 10 to 14 years of age, 11% have been received at least one dose of vaccine. For those 15 to 19, about 30% have received one dose of the vaccine. And in Hall County, sorry, this up. In Hall County, 6.7% of our children 10 to 14 years of age have received at least one dose, and 26.4% have received one dose that are 15 to 19 years of age.
Okay. We've all heard the term herd immunity at this point. What is herd immunity, and why is it particularly important in protecting our vulnerable unvaccinated populations, especially children younger than 12 that are unable to get the vaccine yet?
Herd immunity quite simply means that a sufficient proportion of the population has immunity to the illness, and therefore, even if someone is infected with the virus, they're unlikely to transmit it to someone else because everyone around them is already immune. Now, you can have herd immunity through natural infection, or you can have herd immunity through vaccination. In all likelihood, at this time, any immunity we have in our community is a combination of those two. But we most certainly have not, through vaccination, reached the level that's required to prevent the propagation of the vaccine and of the virus in our community. So, for instance, we had 170 cases of COVID-19 in the last 2 weeks. That's about 82 per 100,000, 82 cases per 100,000. That's still a high level of transmission within our community. Our positivity rate is around 5.8%. Again, that shows a relatively high rate of transmission. It's not as high as it was certainly during our surge back in the winter or last summer, but we are still having the propagation of this virus within our community. And we have not yet reached herd immunity either through vaccination and a combination with natural immunity from infection.
Yes, thank you, Dr. Taylor, for that. It's important to remember we're not fully out of the woods quite yet. I would like to move on to Dr. Manapali. Dr. Manapali, the Pfizer vaccine is an mRNA vaccine. People have the perception that this is a new technology, but the mRNA technology has been undergoing development and testing for years. Talk to us about the science behind the vaccine and how long it takes to become fully vaccinated.
That's a great question. mRNA means messenger RNA. Basically, it's a strand of genetic material. This has been researched for decades and decades. This has been looked into therapies related to various cancers, other infections, even Ebola. Vaccines related to Ebola as well. So the thing is, it just came to us available readily so that we can actually get the vaccine developed in a record time and also mass produced. So all the vaccine is doing is this material, when it's injected, it instructs the cell to produce protein. And in terms of the COVID-19, it's the spike protein. This spike protein is what the virus uses to attach to the cells. So basically, we're fooling the body that it's infected with the virus when it is not. The vaccine itself does not contain any live virus in it. So the body starts producing the immune response or the antibodies. So when actually we are exposed to the virus, our body is ready to fight that. So that's the science behind how these vaccines work for the Pfizer.
And then, can you talk a little bit about how long it takes to become fully vaccinated after someone receives the vaccine?
So the vaccines need time to develop this immune response so they can protect us. So especially when it comes to the 12 to 15-year age group, the one that's currently available for them is the Pfizer. And that requires 2 doses 3 weeks apart. And we need at least 2 weeks after completing the 2-dose series for them to be fully vaccinated. And for any other vaccine, it's the same. For Moderna, it's 4 weeks apart, 2 doses. And for the J&J, it's single shot, but need 2 weeks after completing the vaccine series to be fully vaccinated.
And what does that mean if someone is fully vaccinated? What does that mean for their health?
I think what it means is that they have the antibodies to protect them. So the way I kind of differentiate is masks reduce the risk of exposure. And even if we are exposed, the antibodies in our body protect us from developing the infection. And some of us may have heard of these rare breakthrough cases that are happening with the new variant. But one thing I want everyone to note is that it's extremely rare for anyone who's vaccinated to develop infection. And even if they do, those are mild or asymptomatic. The most important thing when it comes to the vaccines is that they prevent severe or critical illness and save lives.
Yes, they do. I wanted to ask, since the vaccines have been out, has there been any new studies or data released since May about the effectiveness of the vaccine in adolescents, as well as any side effects in adolescents?
Again, great question. CDC continues to monitor the data through their the VAERS, that is the Vaccine Adverse Events Reporting System, and the vSafe, where we can actually report any of our side effects and experiences as well, and they follow. Also, the data that was used from the study in the 12 to 15 years old has been published in the New England Journal of Medicine recently. If anything, the vaccine in that particular age group was 100% effective in preventing infection. So actually, that age group fared better than the little older age group, the 16 to the 20s. And the other things to note is that, again, it continues to be monitored. And a few things some of us or all of us may have heard of is the myocarditis or pericarditis. This is the inflammation of the heart muscle or the lining of the heart. And this is an extremely rare side effect. Out of 170 million or so doses, or people who have been vaccinated with at least 1 dose, 1,000 plus people have been diagnosed with this. And the most common symptoms are chest pain, shortness of breath, or heart palpitations, and usually happens after the 2nd dose after a few days, and it is treatable. So I think one thing we need to note is that while this is it is a rare side effect, and myocarditis or pericarditis from COVID-19 infection is more common than this from the vaccine.
Thank you for that. You touched on antibodies earlier. One question that I get a lot in the office is, if someone had the virus, had the infection, and they have antibodies, why should that person also get the vaccine?
I think it's extremely important that even if someone has had the infection, they should get the vaccination. We believe that the immunity generated by the vaccine is more robust and longer lasting than the natural immunity, because we have seen reinfections even after 3 months in some. And the other is the variants, because we're continuing to study about the variants. And the data we have today, it shows that the vaccines that are currently available are effective against the variants.
That's definitely good news and good information. Thank you for that. I would like to go to Dr. Farley. Dr. Farley, last time we discussed that the CDC was investigating a possible heart problem in a few young vaccine recipients. Dr. Monopoli touched on that topic. Can you provide any updates on that investigation?
Really, she explained it very well. Certainly the myocarditis and the pericarditis, the inflammation of your heart muscle or the lining around it is worrisome. And the bottom line is, yes, we are seeing it as a possible side effect from the vaccine, but much more worrisome is when you have it as a side effect, or say worrisome, more common is to see it as a side effect of the actual disease.
And then one common misconception that I've heard, and I'm sure you have in the office, is that the vaccine may cause infertility. Has there been any data to support that notion?
So far, the infection, I defer to infectious disease experts, but so far it does not appear to have any data supporting any worries about fertility, and really no credible theories on why it would affect fertility. So at this point, that does not appear to be a side effect, but certainly the monitoring systems in place are critical to continue to gather data to make sure that there are no side effects that we're unaware of.
And I would like to add here that, you know, our colleagues at OBGYN through their professional organizations, ACOG, have put out several statements saying that there's not a link between the vaccine and fertility issues. So they're, of course, monitoring that very closely, and they've several times released statements saying there's no link.
I just wanted to add one more thing. I think you covered that the mRNA does not stick around in our body. It does its job. It does not enter the nucleus, does not alter our DNA. So it's not changing any of that aspects related to the fertility. So it does its job and then it's destroyed quickly.
Right. Thank you. Dr. Farley, have you noticed any other trends and side effects from the vaccines being identified for study currently?
I've not in my own patients had anybody really with any side effects other than the common, you know, sore arm kind of thing. One thing that I've been asked about a lot is it affecting menstrual cycles, which again, kind of deferring to our gynecologist colleagues, but there may be some truth to that, and that's really, it doesn't appear to be a worrisome truth though, because women's menstrual cycles are very fickle, especially in teenagers at times. So sometimes any virus, any vaccine, you know, somebody looks at you funny. I mean, there's a lot of ways that women's cycles will get knocked off a little bit, and so certainly does not seem to be an unexpected side effect potentially.
Yes, and I would like to sort of jump in myself here, put on my pediatrician hat, and just talk about a few misconceptions that I hear about in the office. First, there's a lot of misinformation out there, especially on social media, regarding the vaccine. So I would advise that parents discuss their concerns with their doctors so that we can provide accurate information. One of the things that I hear a lot is that the COVID-19 virus doesn't affect children. So why even bother getting the vaccine? COVID-19 is more lethal when it comes to adults and the elderly, but it does affect children. It's not a benign illness in children, and to date, we've had over 4 million children and adolescents in the US that have been infected with the virus. And there have been thousands of hospitalizations and hundreds of children have lost their lives. There's also a risk of MIS-C, which is a serious multi-system inflammatory condition that can affect some children after they recover from COVID. I have personally taken care of patients that have had long-haul COVID symptoms. So it's definitely not a benign illness in children. And then the other question I get a lot about is the long-term side effects of the COVID vaccine. And as Dr. Manapalli stated, that the mRNA is out of your body in a couple of days. And previously for other vaccinations, serious side effects, long-term side effects generally present within 2 weeks to 2 months after you receive a vaccine dose. So we shouldn't expect long-term side effects outside of that window. But the COVID-19 infection itself can cause long-term side effects. So that's something that we want to avoid by getting the vaccine. I would like to go back to Dr. Taylor. Dr. Taylor, we are hearing that the percentage positivity is going back up in our area. Earlier in the summer, we were below 1%, and now it's getting close to 6% positive. What does this tell you, and is there a certain demographic that we are seeing more positives in?
Well, what it tells us is that transmission is increasing as things, you know, as we all got back to somewhat normal life. this transmission is occurring in unvaccinated persons. As Dr. Manapali said, there are sometimes breakthrough cases in people who are vaccinated, but largely we're talking about unvaccinated persons. And I believe that let me see if I can pull this up, because sorry for not having this right in front of me. So almost half, or 43% of recent cases have occurred among young adults 18 to 39 years of age. And we've seen about a 44% increase in cases among children aged 5 to 17 years of age this week versus last week. And we're seeing increases in this younger population, which is the population that we haven't yet vaccinated. It includes children and it includes their parents. So it is circulating within that group. And I think that we have an opportunity now to control this virus so that our children are able to have a normal school year. We all want that. We all want them to be able to be in the classroom. We know that that's where they need to be to really learn. We have an opportunity, but we can only do that through vaccination. And for those who aren't vaccinated, if you're ill, stay at home. And if you are identified as having COVID-19, you should follow the orders of isolation, and those who have been in contact with you should follow the orders of quarantine. I will point out that persons who are vaccinated, as long as they remain asymptomatic, do not have to quarantine if they're exposed.
And Dr. Taylor, we're hearing a lot about the Delta variant. Are we seeing that in our community?
Yes, we are. In fact, if you, let me explain just briefly how we know about the Delta variant. A random sample of specimens that are the PCR type, not the rapid antigen test, are sent for this further testing to identify the variant. So we don't test every specimen for the variant. So in part, this is somewhat modeling based on the results of those random tests that we're doing on different specimens. So if you look at it, and another thing, it does take a couple of weeks for us to get those results. So whatever we talk about today is about 2 weeks out of date, okay? So if we look at results we had from the first of the month, about 12% of the specimens were positive for the Delta variant. And I've got the data right here. It is now between 30, they're estimating between 37 to 79%. That's within a 2 week period of time. 37 to 79% of those specimens are estimated to be Delta variant now. So we're seeing a dramatic rise. It's about 80-something% across the country. It is the predominant variant within the United States now, and it appears that it is the predominant variant within the state of Georgia. So it's rapidly becoming the variant that we're concerned about. It does appear to be more transmissible. It more easily attaches to the cells within our nose and throat and can enter those cells and cause infection. And we're also concerned that it may cause more severe disease. So I think that we should all be concerned about this. Again, the vaccines are effective against the Delta variant. They prevent infection, they prevent severe illness, they prevent hospitalization and deaths. So the way to control this new variant that's arising in our population is, if you're eligible, get vaccinated. If you become ill, stay at home, get tested, and follow the recommendations of public health about isolation and quarantine.
Dr. Taylor, where is this data coming from about the infection rate? Like, how do you guys get that data?
So we get that data because COVID-19 is a reportable illness. So if a doctor a laboratory, anywhere that is authorized to do testing, if they do the test, they're required to report it to us. So we can tell from the number of tests that are done, what percentage of those are positive. The variant testing has to be sent off to specialized laboratories for that type of testing to be done.
Thank you for that. Dr. Manapali, I would like to go to you. I know I touched a little bit on earlier that yes, COVID-19 is not as severe in children as it is in adults, but there can be serious complications for children as well. Is that the same for the Delta variant, or is it affecting children any differently?
So what we are observing with the Delta variant is that it is affecting the younger healthy people and also children more. And this has been observed in India, where we believe it started, in other countries, and in some of the states now that we are seeing the clusters. So that is very concerning. Anyone 12 and above has access to the vaccination now. So it's the responsibility of all of us to protect those who are younger than that, who don't have the access to the vaccine yet.
And then I wanted to ask you a question that we got online just now. Does the vaccine have the same symptoms in children as the COVID infection? I think a parent's concerned that after they got the dose, they felt kind of tired and achy, and they're worried about giving that vaccine to their children because of the side effects. So what would you say about that?
So the most common adverse effects after the vaccination are mild, and they occur right after the vaccination, like the injection site pain, and especially after the second dose, more than the first. Some of us will experience maybe some fever, muscle aches, headache, fatigue, and those resolve in a few days. It's just that your body is trying to build that immunity following the vaccination, so the vaccine is doing its job. With COVID-19, you would have some other symptoms as well, like the sore throat, congestion, maybe cough, shortness of breath, chest pain. So yes, all these adverse effects that I mentioned, these are mild, these are self-limiting, and just an indication the vaccine is doing the job. So that should not be the reason for us not to give someone the vaccination, because as we know, COVID-19 can cause severe illness and symptoms and even deaths.
Yeah. And then I want to ask you one more question. Just last week, it was announced that they will be holding the release for an authorization for the vaccine for kids 12 and under until the first of the year, when there's 6 months worth of trial data. Why are they recommending this delay for children younger than 12?
I'll have Dr. Taylor add to this, but I'll tell you what I'm aware of is that one thing, I mean, children are not just young adults. Their immune systems, work differently. They're at different levels of maturity. And we're also talking about an age gap from just infants, few months, to up to the 11-year-olds, right? So there are studies ongoing now. Pfizer is enrolling up to 4,000 people. They're looking at various categories like the 5 to 12s, and then the 2 to 5s, and then younger than that. Moderna is doing the same. I think their subset is a little larger, around 6,000 plus. And we may get the data for the older, the 5 to 11, 12 years earlier than the younger. I think it's important that one, they need to identify the right doses that are safe and are also effective, which means the vaccine is producing the immune response that we want, but at the same time safe. And two, the number of doses needed. So they have to study all these aspects. And again, anything, if we all want the vaccine, I have a 6-year-old, I want him to get the vaccine now. But whatever the delay or the wait is just to ensure safety and the efficacy.
Okay, thank you. Yes, we all want them to take as much time as needed to get a safe, effective vaccine, especially for the younger age groups. I'd like to go to Dr. Farley. Dr. Farley, since that leaves children younger than 12 unvaccinated longer, should parents be concerned for their younger kids as we approach return to school, especially with this new variant?
Well, of course. I mean, I think that's of course answer. we all, I think, are in the same position of we want our children back in school. I mean, they need that academically and mental health and socially. There are so many, nutrition. I mean, there are many reasons we need our kids back. But that younger group is at risk because they are not eligible for the vaccine. So absolutely, I think parents should be aware and, consider masking their children, especially as we go indoors for the winter. Summer outdoors is a whole nother story, but we're heading back indoors. So yes, I think that parents shouldn't let their guard down too much at this point.
And then that leads me right into my next question. For parents, as far as keeping kids safe, what are your recommendations about mask wearing and social distancing?
That is a hard subject, and little kids are not very good at mask wearing and social distancing, but they follow what their parents and teachers ask them to do. They do listen to us sometimes. So obviously we'll hear from the school folks what the official plans will be, but certainly I think it's worth parents strongly considering masking their children who have not had the opportunity to be vaccinated. I do think that another important thing that we don't always talk about, and this predates COVID, but is just sort of parent responsibility in terms of, your kid wakes up with a fever of 101 and a little runny nose, and you give them some Motrin and you send them off to school, and then the school nurses are seeing them at 1 o'clock when the fevers pop back up and they feel cruddy. And especially with this more potentially more easily transmissible disease or variant, I don't think that that's something we want to do, is risk exposing other people. So, basically, and again, this predates COVID. Parents have done this forever. And we understand, obviously, parents have to go to work and there's lots that goes on with that. But the bottom line is, if your child has a fever and is sick, even if it's not COVID, keep them out of school until they're not infectious anymore.
I think we can definitely all echo that about staying home if you're sick or your child is sick. And then about masking, the AAP just a few days ago released a statement emphasizing the need for masking in schools for K through 12th grade students, as well as teachers and staff, to protect the younger children who cannot yet be vaccinated. I would like now to jump to our school representatives. Let's address probably the two most common questions about returning to school. First, will you require masks as kids return to school?
This is Andrea Williamson-English with the Hall County Schools in Gainesville City. Masks are optional and encouraged.
Okay. And then do you anticipate requiring COVID-19 vaccination for those 12 and older in order for them to participate in in-person learning?
So the COVID-19 vaccine is not required to attend in-person learning.
And I second that. For Lakeview Academy as well. Masks are going to be optional for all age groups, but again, like to reiterate what Dr. Farley said, highly encouraged for those that have not been able to yet receive the vaccine, and or our kids that have some chronic illnesses, higher acuity, any immunity issues, things of that nature, of course, are all taken into consideration. So strongly encouraged, but not required.
Scarlett, I want to address this to you. Things are changing daily when it comes to COVID in our community, especially now with the variants. How are the schools approaching the school year at this point in regards to the safety protocols during COVID? And can you speak on the factors that may go into decisions for the coming school year?
Sure. So we have a task force that's comprised of physicians and administrators and myself. And we meet regularly to discuss and follow the ever-changing data and environment. The CDC gave us some new guidelines recently, and in those guidelines, they directly address the Delta variant, and that it should definitely be a factor in the school's decisions and provision strategies. The community spread of COVID-19, and especially with the variant, it might lead us to strengthen our prevention strategies. We really want to emphasize that we're here to keep our community healthy and safe. We want our students, our faculty and staff healthy and safe. And what we do in our buildings directly affects the community at large. It affects what's going on at the hospital. So those are kind of some of the things that, we'll take into account for sure. What does vaccination rate look like? What are the community spread percent positives? What's current hospital bed availability? All the things that we took into consideration last year will overflow for this year. We'll continue to monitor the situation in our local space, not, nationally, of course, but, putting a lot of emphasis on what's going on directly here in this community, and then make the best decisions with the information that we have at the time.
And as you will be monitoring those changes in the community, could the mask policy change? Could they be required at some point?
I think that there definitely would be a time at which we may ask our population, our schools, to put on the mask again, especially like you said, when we're indoors in the winter. It's an interesting thing and good point to make, that masking, it cut down significantly on not just COVID spread last year, but respiratory illness in general just plummeted. So it is a mitigating strategy that works. We don't want to have to do that, but we would rather ask to do that rather than go remote again or have to shut down an entire division. One of the things the CDC recommends is for us to look at each of our, our middle schools, lower schools, high schools, and we report our numbers. I mean, just so everybody knows, part of how, I think you asked a question earlier about how you get your numbers. Every Friday, I had a direct link to District 2 Public Health, and I would report every new case, how many people were on quarantine, break it down by staff, faculty, and students. So there's a lot of data collecting, a lot of reporting and paperwork and trails that give us the information that, that we have and the reasons behind our decisions. They're not arbitrary rules. And certainly, I think I can speak for Andrea here too, that we actually don't make these rules. These are guidelines that are done, that we are following. And in the interest of being completely transparent and consistent, we will continue to follow the CDC guidelines. So yes, we will do what we need as needed, I think, and that's always an ongoing discussion with the task force. Never just a one-person decision.
I know things are in flux and lots of changes, so I appreciate all the hard work that you guys in the school systems have been doing. Andrea, I would like to go to you. I know that Gainesville City School System and Hall County School System have been working over the summer to align their protocols. Andrea, you work for Hall County School System, so can you share with us the kinds of discussions you are having in this work and the kinds of protocols you are looking at this year?
Yes, thank you. So both systems are communicating on a regular basis to ensure that we have a safe, comfortable, and welcoming learning environment. That's very important to both of these systems. We also rely heavily on the expertise of the Center for Disease Control and Prevention and the Georgia Department of Public Health. They definitely are a big part of our driving decisions. 6-day protocols reflect local decisions, as Scarlett talked about, and we are optimistic they will be less restrictive this year.
Okay, that's good to know. And then Scarlett, what about class and classroom structure for next year? Are there mitigating strategies you think that you will continue from the past year?
Yes, certainly. Absolutely. So one of the things we did was a daily attestation, and we are not going to do that in the same capacity that we did it, as in you won't be filling out maybe an app, so to speak, or an online survey, but we fully expect that our parents will actually do that attestation and take on that aspect, that component of monitoring and assessing your child before school entry. So again, to piggyback on what Dr. Farley said, the number one mitigating strategy of this year is please don't send kids sick to school. Other things that will continue, we will continue to learn how to wash our hands effectively, respiratory etiquette, learning how to sneeze in your elbow, all the things we do with the kids, physical distancing. You know, I think the new regulations and guidelines speak to that in very specific areas, classroom settings, school buses, et cetera. And they've gone from that 3 to 6 foot. At Lakeview, we have a smaller student population, so it's a little bit easier for us to maintain that physical distancing in our classrooms. So we're very fortunate in that respect, and we will continue to encourage that where appropriate. Disinfecting, classrooms and hallways and bathrooms regularly every day, sometimes multiple times a day. So all of those things will stay in play.
And then Scarlett or Andrea, will your elementary kids have different rules about mask wearing than other grade levels since they cannot be vaccinated?
So masks are optional for all grades.
Okay, so the same rules apply.
Same rules apply.
Okay. And then Andrea, we understand at this point, masks are optional regardless of vaccine status. We've discussed that. Would you recommend your unvaccinated staff, students, and those 12 and under to wear masks at school?
So it is in my professional opinion that all unvaccinated individuals, and in some cases vaccinated individuals, should wear a mask when indoors and in group settings. Although the COVID-19 infection may be fairly mild for children and adolescents, that is not always the case. Masks continue to be a very strong mitigating strategy and very simple.
And I would agree. I'll say that, so as school nurses, we take care of children with higher acuity and chronic conditions in our schools on a daily basis. Andrea has acquired new children with COVID long-term chronic conditions now. So it definitely affects children, and have added them into our queue of taking care of them in some way, during the day. And I think I piggyback what she says, it's extremely important to be aware that there are those children in our midst, and, your child may be perfectly healthy, but they might be sitting right next to a child that is recovering from cancer, has a weakened immune system, has chronic asthma, just lots of different things. And so we want to be mindful of that and aware. And, we'll do our best to encourage proper etiquette in those situations.
And I'll echo both of you guys about how important masks have been to help stop the spread and protect especially the vulnerable population. Andrea, I would like to ask you, I know we've learned a lot over the past year and a half plus. What has been your greatest lesson you've learned during COVID? Are there any takeaways you think will continue, even as we hope we at some point put COVID in the rear view mirror?
Yeah, so for me, my greatest lesson was really learning that the effectiveness of our simple mitigating strategies were powerfully potent. Things such as masks voluntarily worn, hand washing, respiratory etiquette, like we talked about, that cough and sneeze in the sleeve, and staying home when you are sick. Although they seem too simple to be true, they are truly powerful ways to protect the prevention and the spread of respiratory illnesses, not only COVID-19, but also other circulating illnesses like the flu.
Yeah, very important. Can you tell us about the protocols for quarantine for this coming school year?
So at this time, the Hall County School District guidance regarding that quarantine and contact tracing has been unclear and inconsistent. The Hall County School District will release its protocols prior to the start of the school year. Gainesville City Schools, for those folks who are listening in, They are maintaining their same protocols as they did last year at this time.
And for Lakeview Academy, we're going to continue to follow DPH and CDC guidance, just like we did last year. It will definitely be our driving factor, and looking at our community numbers and, conferring with our medical task force team as to what's needed to, in the moment.
And then another question I have for you about vaccine requirements for school. How are these requirements determined? Is that a local decision?
So schools do not mandate vaccines. The Advisory Council of Immunization Practices, nicknamed the ACIP, they make recommendations for the entire nation. The Georgia Department of Public Health then determines which vaccines are mandated. So schools are not in that process at all.
No, we're just here. Our role is to ensure compliance and be sure that the state mandated vaccines for school entry are up to date.
And then Scarlett, I'll address this to you. The updated vaccinations that are required for children. We know that schools and colleges and universities have certain requirements. Have there been any changes in what is required from a vaccine standpoint for our elementary school through high school kids for this upcoming school year?
We had some changes that actually happened prior to COVID, and then we sort of, they gave us a grace year to get those out to parents and for parents to get up to date on that. But yeah, so we will continue to uphold the state mandated school entry immunizations. They are the same ones they've always been. However, there are some updated requirements for 7th and 11th grades. For 7th, it's the MCV4, which is one of the meningitis vaccines, and also a Tdap booster, specifically kind of focusing with pertussis on that one. So 7th grade has some updates, and so if you haven't had a physical in a year or two, and you're a 5th, 6th grader, those are, definitely if you're coming into 7th grade, that's something to ask your pediatrician about when you visit. Just, am I up to date? Do I have what I need? And then also in the 11th grade, it's the MCV4 booster. So that was very important last year, actually, with our senior class. I did send some correspondence out when reviewing those records to some students who had not yet gotten that vaccine or that booster, because it was actually a requirement for many of them as they applied for housing. So they were denied their application for housing until they could produce proof of that vaccination. So I'll go ahead and preempt that kind of thing from happening by making sure that I am looking at that for them and sending those notices. I mean, we're all very busy, and especially senior year, so I just I let parents know ahead of time, look, this is what's going to be asked and this is what's coming. These are some of the new updates for the boosters, and for the most part, they're, excuse me, very, very appreciative that, that they can get that done in a timely manner, and it doesn't impede the application process.
It's really important to note here that if you delayed any of your child's vaccines last year because of the pandemic, the best next step is to get them back on track, to bring them to your pediatrician's office. We know that vaccinations, the routine vaccinations, are so important for the health of our children, and especially the community as a whole. If you want to get your child vaccinated, some of these vaccinations can span weeks or months or years. So it's important to start that process for both the COVID vaccine as well as the other routine vaccinations. I wanted to just jump back to Dr. Malapalli for a quick question about the spread of COVID when it comes to those that are vaccinated versus those that are unvaccinated. So this is an online question, and I think the clarification is, if there are breakthrough infections in those that are vaccinated, can those people also spread the virus the same way as those that are unvaccinated?
the risk of transmission from those who are fully vaccinated is less, but that's not zero. So yes, that's why we always say that please get vaccinated if you're eligible, because one, it prevents you to the most part from getting infected, even if you're exposed to the virus. And even if you get infected, you have a mild disease or asymptomatic disease. So one of the things, I think that's why I know that we've already mentioned about that during the chat, is about when you're in a large crowd, especially indoors, even those who are fully vaccinated should consider wearing the masks.
Thank you guys so much. As we wrap up today, I just want to open it up to the panel. Is there anything left that we have not addressed or that you would like to touch on? Okay. We understand that this is an overwhelming process for parents to navigate. We all want to look out for the well-being of our children. As pediatricians, it is our life's work to keep your children, to keep our children healthy and safe. As you are determining what is best for your child for the school year, we encourage you to please talk to your doctor about any and all concerns that you have. There's risk in almost everything that we do, but the risks associated with contracting and spreading COVID-19 far outweigh any risks of vaccination. And remember, if you want your child to have this protection, the process should start as soon as possible. Thank you so much to Dr. Farley, Dr. Monopoli, Dr. Taylor, Andrea, and Scarlett for joining me to answer these questions today. We appreciate everything that all of you have done and continue to do to keep our kids and the community safe. And thank you all for listening, taking the time to listen. We know all the parents out there want to make the best decision for their families, and we really hope that we were able to give you some information that will help you make those decisions. Please share this post if you found this information helpful. Thanks again for tuning in.
Thank you, Dr. Hussain.
Thank you.